how to reduce tinnitus naturally with trying alternative health treatments or talking with your doctor. Tinnitus, pronounced tinnitus by most physicians, although others pronounce it tinnitus, is the perception of sound when no actual external noise is present. These sounds are most often perceived as ringing, but can be heard as buzzing, roaring, whooshing, swishing, clicking or hissing sounds. Millions of people around the world experience tinnitus. In the US, over 45 million people, or about 15% of the population, have symptoms of tinnitus, while over 2 million people have extreme tinnitus. Tinnitus can be a symptom of a more serious disorder, including ear injury or hearing loss, sensorineural and age-related. It can be an extremely debilitating condition. Treating tinnitus naturally involves diagnosing the condition, trying auditory therapy and being open to other methods. Understand what tinnitus is. Tinnitus can range from very loud to very soft sounds, can be loud enough to interfere with normal hearing and be heard in one or both ears. You may hear ringing, buzzing, roaring, clicking or hissing sounds. There are essentially two types of tinnitus, subjective and objective tinnitus. Subjective tinnitus is the most common form of tinnitus. It can be caused by structural ear problems in the outer, middle and inner ear, or by problems with the auditory nerve pathways leading from the inner ear to the brain. In subjective tinnitus, you are the only person hearing the sound. Objective tinnitus is much rarer, but can be perceived by a physician during an examination. This can be caused by vascular problems, muscle contractions or conditions related to the inner ear bone. Determine your risk factors for tinnitus. Tinnitus tends to affect men more often than women. Older people tend to experience tinnitus more than young people. Some of the key risk factors for tinnitus include: age. The peak age of first experiencing tinnitus is between 60 and 69 years. Gender. Military service, exposure to loud explosions, gunfire, loud machinery. Employment in a loud workplace environment. Listening to loud music. Those exposed to any loud noise, either through work or through leisure activities. A history of depression, anxiety and/or obsessive-compulsive disorder. Take the Tinnitus Handicap Inventory Questionnaire. The Tinnitus Handicap Inventory, a questionnaire from the American Tinnitus Association, may be a good place to start. This questionnaire asks you to assess your level of auditory problems so that you can determine the extent to which tinnitus affects you. This can be a good first step in figuring out how to treat your tinnitus.
Going under.